Hello, this is Dr. Manos Chakraborty. Today we will be talking about ovarian cancer, its symptoms, causes, treatment, and preventions, and few other interesting things. So let's start. Today's discussion will be very short and we'll be touching the headlines. So let's start with the symptoms. Now, there is a very interesting fact here that when we went to medical colleges, we were told that ovarian cancer does not produce symptoms. Well, it does, but unfortunately, the symptoms are non-gynecological. It is actually gastrointestinal tract symptoms, and therefore, it is so easy to miss that most of the ovarian cancers present at a very late stage to the doctors. So today, we are going to touch on the symptoms based on the researches which has happened over last 10 to 15 years' time. Most ovarian cancers present with bloating in the abdomen that is persistent. Many people will have a little bit of bloating every now and then, but the bloating that is persistent calls for further evaluation. Eating less and feeling fuller after only eating a little bit, that could be a sign of ovarian cancer as well. Apart from that, pain in the abdomen or back pain and trouble with the bladder and bowel habits can be a sign of ovarian cancer. Along with that, sometimes women complain of unusual fatigue, bleeding and clotting symptoms as well. Because of the fact that these symptoms are so subtle and so easy to miss, most of the ovarian cancers, when they come to doctor, they have started accumulating water inside the abdomen and disease has spread beyond the ovaries. Well, now that you know all these symptoms, I'm sure that you will be able to save few lives. Not all the causes of ovarian cancer could be found so far by science or research, but what we know so far is basically every time the egg comes out of the ovary, it causes a small little wound on the surface of the ovary. Every time their egg comes out, there will be a small wound. And over the years, this accumulation of the wounds may give rise to ovarian cancer. Because every time there is a wound, there are sudden cell divisions happening over there, and sometimes the cell divisions can become uncontrolled. That is actually a cancer. Of course, more researches needs to be done, but so far we know the pregnancies and taking oral contraceptive pills can be protective for ovarian cancer. Because in the pregnancy, egg doesn't come out from the ovaries over 10 months, and if of course the lady is breastfeeding, another 3 months the egg doesn't come out. So that is a protective factor for ovarian cancer. Oral contraceptive pills, which women can sometimes take it because of the contraception as well as for other hormonal manipulation like in polycystic ovarian syndrome and stuff, if they take oral contraceptive pills, that also prevents the egg coming out from the ovaries, though temporary, but it avoids those little wounds on the ovarian surface and avoids ovarian cancer. Apart from these damages on the ovarian surface because of the ovulation or egg coming out, it can be related to some genetic factors or hereditary factors. Many of them are known as BRCA, that is a genetic defect where the breast and ovarian cancers can run in some families. Another little complex name which is known as HNPCC families. In those cases as well, colon, ovarian, prostate cancers can run in various members of the families. Not all the ovarian cancers are hereditary. Some of them will be. In those families, treating ovarian cancers can be very fruitful and very effective as well if you know about it. So checking the family history or the family tree history is so important in terms of treating ovarian cancer. Investigations. And of course, if it is suspected, any ovarian problems are suspected, then doing an ultrasound will be the first step of management, and doing some tumor markers, and popularly known as CA125 as well, and few other tumor markers can be helpful. Once the suspicion is higher, sometimes we may need to do a CT scan or sometimes even higher scans like MRI or PET CT scans to check what is going on. The firm diagnosis or the confirmatory diagnosis eventually comes from a biopsy test. And this biopsy could be a tissue from the tumor or where the tumor has spread from there, or it could be a study of the cells which floats around the accumulated water inside the abdomen, which is known as cytology. Cyto means cells and logy means study. Let's now move on to the treatment part first. Now, once the ovarian cancer is detected or suspected, and the treatment starts with the surgery in most of the cases, well, where it can be done or where doing the surgery is beneficial for the lady. Sometimes we see at the time of diagnosis of ovarian cancer, the general condition of the patient is such that having that type of surgery at that particular point may not be suitable for that patient. In those cases, sometimes we see that giving chemotherapy before to control the disease, which is running rampant inside the abdomen, controlling the disease with the chemotherapy somehow, and doing the surgery as a second step procedure can be helpful. Now, this is called a sequencing of the treatment, that whether the surgery will be first or the chemotherapy will be first. And these are based on so many important factors that it is not possible for me to give you all the information about that in this little video. But generally, the ovarian cancer treatment starts with the surgery. If it is contained within the ovary, then surgery is the main treatment or the only treatment that the patient will need. And sometimes if it has spread or in certain subtypes of cancer, after the surgery, 6 cycles of chemotherapy may be needed. As I said, in the cases where the surgery was not suitable for that patient, in those cases, the chemotherapy is given for 3 or 4 cycles first, and the surgery is done, and further sets of 3 or 4 chemotherapies are given after that. So here the surgery is kind of a sandwich therapy, which is known as neoadjuvant chemo, interval surgery, and then chemo afterwards. Now, I must mention that not all the cases of ovarian cancer will need extensive surgery. Sometimes when the ovarian cancer is kind of confined within one ovary, and it is a little bit more friendly variety of ovarian cancers and stuff, and it happens in a young woman. In those cases, sometimes fertility preserving surgery may also be suitable in carefully selected cases where women can continue to have a baby and a pregnancy afterwards. Prevention. Now, preventing ovarian cancers may not be possible all the cases. There have been a lot of researches going on how to prevent ovarian cancer, but none of them has been successful so far. But I am very hopeful that in future there will be some tests in the blood and some genetic tests within the blood which will show us the future. But so far, in the families where hereditary ovarian cancer runs, particularly BRCA family or HNPCC family, there can be some mathematical model where it can be predicted and what age of that patient the ovarian cancer will start. Maybe suppose it will start at age 43 or something like that. In those cases, if we can do a preventive surgery before that, then in those cases the ovarian cancer will be prevented. These type of surgeries are newer variety of surgery which is known as risk reducing surgery. That's all today. So those were a little bit discussion about ovarian cancer in a nutshell. But if you want to know a little bit more about any of those points that I have mentioned, feel free to let us know. Have a good day.